In this video, I will discuss what is modafinil. Modafinil is an FDA-approved narcolepsy medication. Modafinil increases wakefulness and daytime alertness. It is generally used by people who experience excessive sleepiness during the day. Modafinil is described as a wakefulness-promoting agent. Modafinil is useful for narcolepsy, obstructive sleep apnea, cataplexy, and other disorders characterized by hypersomnia or excessive sleepiness. It is often used off-label for attention deficit disorder, ADD, and attention deficit hyperactivity disorder, ADHD. Shift workers are known to turn to modafinil for staving off sleepiness. Modafinil is very popular as a study aid and as an intelligence booster. It is the active substance in Provigil, Modalert, Modapro, Vigicer, Sparlon, Allertec, and others. Modafinil is classified as a eugoroic substance, meaning good arousal. Eugoroics aim to create an optimal and level plateau of attention over several hours. Eugoroics are designed to allow the patient to sleep if they want to and to stimulate when stimulation is required. Eugoroics are considered superior to amphetamines because they do not have the highs and lows associated with amphetamine use. Military forces around the world are exploring eugoroics as a superior alternative to amphetamines for situations when sleeplessness and concentration need to be maintained. For example, extended covert operations. The eugoroics class of drugs only contain two substances at present, adrafinil and modafinil. Both have been developed by Lafon Laboratories of France. Modafinil is considered superior to amphetamine or pemoline, the most widely used drugs for narcolepsy, hypersomnia, and cataplexy, because it has less cardiovascular side effects, less interference with sleep, fewer psychiatric disturbances, and lower addiction potential. Also, amphetamines are described as vigilance increasing, but modafinil is described as vigilance promoting. There is extensive off-label use of modafinil for the purpose of cognitive enhancement. But since everyone's brain chemistry is slightly different, reactions with modafinil can vary greatly among individuals. Modafinil may be very useful for some and a health risk for others. If you wish to try modafinil, you need to start with the lowest dose and very closely monitor your reactions. Long-term or continuous use of modafinil should be combined with blood tests, including an assessment of liver enzymes. Even when used for the purposes it was developed for, modafinil is not appropriate for all patients. A thorough medical history should always be taken before prescribing modafinil. Patients with a medical history which includes kidney disease, liver disease, mental illness, chemical dependency, heart attack, high blood pressure, angina, left ventricular hypertrophy, mitral valve prolapse, chest pain, or irregular heart rate may not be able to tolerate modafinil. Depending on the condition and the severity of the condition, modafinil may require careful monitoring while undergoing therapy. In most situations, I would advise against using modafinil, but I believe many will try it anyway, so you might as well be correctly informed. In this video, you have learned what is modafinil. If you want to discover things about modafinil which aren't included in this video series, then go to damianalexander.com/modafinilpdf. If you want to learn more about critical nutritional supplements, life extension, and disease prevention, then subscribe to my YouTube channel at Damian Alexander's Vids. Lastly, discover the easiest and shortest way to double physical and mental energy, strengthen immunity, and restore health by visiting howtochangeyourownbatteries.com.